We start at the brainstem, the oldest and central core of the brain. The brainstem is located at the position where the spinal cord swells to enter the skull. The brainstem controls the body's automatic survival functions, such as breathing, heart rate, etc. If a cat's brainstem is severed from the rest of the brain, the animal will still be able to breathe and live, run, climb, and groom. The brainstem comprises of the pons, the medulla, and the midbrain. The pons is located directly above the medulla and it serves as a connection between the upper and lower parts of the brain. The pons sits directly atop the medulla, acting as a bridge between the spinal cord and the higher parts of the brain. The pons has neural connections in the limbic system. The pons is associated with emotional and stressful events. It has also been shown to play a role in sleeping and dreaming, as this is where REM sleep originates. The medulla oblongata is located in the lower parts of the brainstem and it controls the basic functions of life. It controls functions like breathing, heart rate, blood pressure, swallowing, etc. During surgery, one must be very careful to not damage any parts of the medulla. Although damage to other parts of the brain can be dealt with accordingly, damage to the medulla is the hardest to fix because of the important functions it carries out. The midbrain is the northernmost part of the brainstem, and it serves as a vital connection between the hindbrain and the forebrain. The inferior and superior colliculi are two sets of ganglia or clusters of neurons and connected synapses that send visual and auditory information into the forebrain. They also play an important role in body coordination. The substantia nigra is a crucial part of the midbrain which controls the production of dopamine. It is also an important relay station for nerve signals from our CNS which control our movement. People with Parkinson's disease have damaged substantia nigra. The frontal lobe is located directly behind your forehead. It controls a whole host of functions, from social and sexual behavior to muscle movements. The frontal lobe is our emotional center and the hub of our personality. The left frontal lobe controls language and its related movement, while the right frontal lobe controls non-verbal activities. In the 1850s by Paul Broca is one of the main areas responsible for producing speech and language. It also controls the motor functions needed when producing speech and comprehending language. Damage to this area causes Broca's aphasia, or the inability to create sentences. The prefrontal cortex is a cerebral cortex covering of the frontal lobe. It controls planning complex cognitive behavior, personality expression, decision-making, moderating social behavior, and executive functions. The DPFC integrates information from the other lobes in the brain. It is considered to have an overall management of cognitive processes. The left dorsolateral prefrontal cortex is associated with approach behaviors and the right with more avoidant behaviors. The orbital frontal cortex is a conversion zone for emotional and sensory information. And because of its close connection to the limbic system, it is associated with our ability to make decisions based on emotional stimuli. The ventromedial prefrontal cortex helps us make decisions based on the bigger picture. It also helps us regulate our emotions, especially in social situations, and it is associated with courage, suppression of negative emotions, compassion, shame, and guilt. The functions of the premotor cortex are discussed in terms of lateral and medial components. When a monkey is trained to reach in different directions in response to a visual cue, the appropriately tuned lateral motor neurons begin to fire at the appearance of the cue well before the monkey receives a signal to actually make the movement. The monkey's LPC has encoded the monkey's intention to perform a particular movement. The medial premotor cortex mediates the selection of movements, but it specializes in initiating movements specified by internal rather than external cues. The primary motor cortex is a strip of cortical tissue in the frontal lobe immediately anterior to the central sulcus. It generates neural impulses that control the execution of movement. The primary motor cortex on one side of the brain controls the muscles on the opposite side of the body. The temporal lobe is found below the parietal and frontal lobes. It organizes sensory input, auditory perception, language and speech production, as well as memory association and formation. Parts of the limbic system, the hippocampus and Wernicke's area are all located in the temporal lobe. The temporal lobe aids in auditory perception and the perception of sound. Anxiety disorders, impaired memory formation, aggressive behavior, and hallucinations can damage the temporal lobe. The almond-shaped part of the brain is located in the temporal lobe. The amygdala's secondary function includes comprehension of people's emotions, the regulation of our sex drive, amongst other things. Mice with damaged amygdalas were unafraid of everything, including cats. Monkeys, on the other hand, were compassionate to those they were previously hostile with. The hypothalamus controls the pituitary gland, heart rate and blood pressure, eating, drinking, sexual activity, and fear and aggression. The hypothalamus was discovered by accident when Olds and Milner incorrectly placed a device, and they found that they had stumbled upon the brain's pleasure center. The seahorse-shaped hippocampus works with the amygdala to form new episodic memories. It assists in the storing of long-term memories and is responsible for remembering people and the location of objects. Amnesia, Alzheimer's, and epilepsy can all be caused by damage to the hippocampus. Below the parietal lobe and above the temporal lobe is the occipital lobe. The occipital lobe processes information from the eyes and links that information with images stored in our memories. The occipital lobe aids with the identification of visual stimuli. It also receives raw visual data from perceptual sensors in the eye's retina. It then transmits this data to other brain regions so those brain lobes can encode memories, assign meaning, and craft appropriate motor and linguistic responses. Damage to the occipital lobe can cause epilepsy, the inability to read written words, difficulty recognizing familiar objects and faces, and difficulty locating objects within the environment. The parietal lobes are behind the frontal lobes and above the temporal lobe. They receive sensory information about the somatic senses, touch, pain, temperature, and the placement of self in objects. The somatosensory cortex is located in the postcentral gyrus. It is responsible for processing somatic sensations which come from receptors positioned throughout the body that are responsible for detecting touch, proprioception, pain, and temperature. The somatosensory cortex is split into 4 areas. Area 1 is used for sensing the texture of an object. Area 2 is used for perceiving size and shape. It is also used for proprioception. 3A responds to information from proprioceptors and is connected to areas 1 and 2, while 3B is concerned with basic processing of touch sensation. The limbic system is a complex system of nerves and networks in the brain. It controls the basic emotions such as fear, pleasure, and anger. It also controls drive such as hunger, dominance, and care for offspring. We've already spoken about the hypothalamus, hippocampus, and amygdala. The final 2 components we'll talk about are the basal ganglia and thalamus. Despite the name, the basal ganglia is not made up of basal or ganglia. Rather, it's a cluster of nuclei. The basal ganglia is the part of the brain that helps us move our eyes and is thought to help with motivation. It can be damaged through carbon monoxide, drug overdoses, strokes, and tumors, amongst other things. Have you ever wondered how your brain knows when to sleep? Well, the part of the brain that controls sleep is called the thalamus. Comas are caused when a person has damaged the thalamus, and damage to the thalamus can cause movement disorders. The thalamus controls impulses that are sent to your spinal cord, brainstem, and cerebellum. Before we leave, here's a joke for you guys. What do neurons use to talk to each other?